So I would like to start with Dr. Rajendra Gupta, who has been working a lot in digital health and has been one of the pioneers in the country. So Dr. Rajendra Gupta, I would like to initiate discussion asking you to throw some light how the digital health is transforming the medical research. And what do you see the future direction as far as the possibilities of digital health is concerned, affecting the health scenario?
Thank you, sir, for this opportunity. Firstly, I congratulate Dr. Prem Agrawal. What I loved about his starting this is he laid bare hard facts, which very rarely people speak on such forums. And I also want to share an anecdote on research. This is very close to me. As an author of 5 books, I am a researcher at heart. So when I was serving advisor to the health minister, we have a library called NML. I think Srini is going to speak in the afternoon, who has the additional director charge for that. They were always, I would not say denied, but devoid of funds. So someone told him to come and meet me, and when he met me, I asked Naddaji that let's review NML. A minister never reviews a library as such. So myself, Mr. Nadda and Mr. Dr. KP Singh, who was director, we reviewed. And I said, sir, let's give him whatever money he asks, because 5% institutions do 95% research. It's not possible to access journals. I still remember he asked for 27 crores and Naddaji looked at me and said, Rajan, what to do? I said, sir, de dete hain. So we issued 27 crores. Not only that, I asked him to write a note that should be put on the landing page of the NML. So I think at that time we invested a lot on NML. And that's very important. Now coming to the question of digital health. I have a quote that I will still repeat, that if you're not in digital health, you're not in healthcare. That's a fact. But what has happened now for researcher is that medical science is driven by data science. It's not the other way around. And I don't know how many of you have a phone or a health app on the phone or using a smartwatch. Can you raise your hands? So just by default, they are subjects of medical research. Their data is with their provider. So I think most of the populations are by default a subject of research. Now question is, who is doing that research? But what I find interesting is the way we do research has changed. The dimensions of data, the longitudinal data, and more than that, what we called as real world data and live data. I think COVID gave us a proof that we could come out with a vaccine in less than a year's time, which is typically a 15-year process. So I think we have the latest evidence of what can be done with digital tools. Repurposed drugs during COVID were thanks to AI. So I think when I look at it, 3 things will change. One is data, second is AI machine learning, and the third is cloud. Because at the end of the day, it doesn't matter where you are. If we are on cloud, we are still collaborators. I think this will change the definition and direction of research, what we call it. So I'm very enthused at what digital health is doing, and still who are late adopters are actually I think adopt or perish is what I would call. Thank you.